Certified Billing and Coding Specialist. Significant points. This is one of the few health occupations in which there is limited contact with patients. Job prospects should be very good, particularly in offices of physicians. Nature of the work. In the past, a medical assistant working in a physician's office performed both administrative and clinical duties. But as decades passed, he or she performed either one or the other. Now, due to changes in government regulations and standards for the insurance industry, specific medical assisting job tasks have become specialized. In a medical practice, it is commonplace to find administrative duties shared by a number of employees: certified medical administrative assistant, bookkeeper, file clerk, certified billing and coding specialist, etc. In clinics and large practices, it is common to find a billing department made up of many people within the department, such as Medicare billing specialist, Medicaid billing specialist, coding specialist, insurance counselor, collection manager, and medical and financial records manager. Fordney, 2004. Coding specialists assign a code to each diagnosis and procedure. They consult classification manuals and also rely on their knowledge of disease processes. Technicians then use a computer software to assign the patient to one of several hundred diagnosis-related groups, or DRGs. The DRG determines the amount for which Medicare or other insurance program use the DRG system will reimburse the hospital if the patient is covered. Technicians who specialize in coding are called health information coders, medical record coders, coder, abstractors, or coding specialists. In addition to the DRG system, coders use other coding systems, such as those geared towards ambulatory settings or long-term care. Billing and coding specialist duties vary with the size of the facility. In large to medium-sized facilities, technicians may specialize in one aspect of health information or supervise health information clerks and transcriptionists, while a medical records and health information administrator manages the department. In small facilities, a credentialed medical records and health information technician sometimes manages the department. U.S. Department of Labor, Occupational Outlook Handbook. Working conditions. Billing and coding specialists usually work a 40-hour week. Some overtime may be required. In hospitals, where health information departments often are open 24 hours a day, 7 days a week, specialists may work day, evening, and night shifts. Billing and coding specialists work in pleasant and comfortable offices. This is one of the few health occupations in which there is little or limited contact with patients. Because accuracy is essential in their jobs, technicians must pay close attention to detail. Technicians who work at computer monitors for prolonged periods must guard against eye strain and muscle pain. Employment. Billing and coding specialists held about 147,000 jobs in 2002. 37% of all jobs were in hospitals. The rest were mostly in offices of physicians, nursing care facilities, outpatient care centers, and home health care services. Insurance firms that deal in health matters employ a small number of health information technicians to tabulate and analyze health information. Public health departments also hire technicians to supervise data collections from healthcare institutions and to assist in research. Job outlook. Job prospects should be very good. Employment of billing and coding specialists is expected to grow much faster than the average for all occupations through 2020, due to rapid growth in the number of medical tests, treatments, and procedures that will be increasingly scrutinized by third-party payers, regulators, courts, and consumers. Although employment growth in hospitals will not keep pace with growth in other healthcare industries, many new jobs will nevertheless be created. The fastest employment growth and majority of new jobs are expected in offices of physicians due to increasing demand for detailed records, especially in large group practices. Rapid growth also is expected in nursing care facilities, home health care services, and outpatient care centers. Additional job openings will result from the need to replace technicians who retire or leave the occupation permanently. Upon completion of this course, the student should be able to discuss an insurance company's claim process, discuss the process for obtaining authorization for additional treatment by a healthcare specialist, discuss the authorization process for a patient requesting an initial appointment with a healthcare specialist, discuss the difference between terms primary diagnosis and principal diagnosis, identify and properly use terms, marks, abbreviations, and symbols used in ICD-9 CM coding system, explain the format of the CPT system, discuss the qualifications for a preventative medicine visit, define the following terms, phrases, and abbreviations: medical necessity, subjective, objective assessments, plan, operative report, OP notes, code diagnosis, and procedures from source documents to complete insurance information on the CMS 1500 claim form, formerly HCFA 1500. State the 4 processing steps that must occur before a completed form can be mailed to the insurance company. Explain function of National Blue Cross and Blue Shield Association. List 6 categories of persons eligible for Medicare coverage. List and define 7 types of insurance programs that are a primary to Medicare. State the deadline for filing Medicare claims. List Medicaid federal guidelines. List services covered under the federal portion of Medicaid assistance. Explain how to verify a patient's Medicaid eligibility. List TRICARE eligibility categories. List 6 services that are not covered by TRICARE. Demonstrate an understanding of HIPAA compliance, PHI, and confidentiality. List and define the levels of TRICARE coverage. List the categories of workers covered by the Federal Compensation Program. List and describe types of workers' compensation available at state level. Describe the correct billing procedures for workers' compensation cases. Describe how to set up a filing system for completed claim forms. Description. This course thoroughly prepares students to code patients' medical records correctly and optimize reimbursement for a full range of medical services. Students are introduced to several techniques for finding and applying the correct codes in today's standard coding systems. Topics covered include current procedural terminology, international classification of diseases, clinical modification, healthcare procedure coding system, resource-based relative value scale, insurance form preparation, Medicare, Medicaid, TRICARE, Blue Cross Blue Shield, workers' compensation, no-fault, HMOs, diagnosis-related groups, peer review organizations, and ambulatory patient groups. Method of instruction. This course utilizes a lecture and demonstration methodology. Introduction to Health Insurance. Introductory course that gives an overview of the insurance industry. What is health insurance? Disability and liability insurance. Major developments in health insurance coverage statistics, third-party reimbursement methods. Anatomy, physiology and terminology, admin, and CBCS, not for clinical rotations. This course introduces students to medical terminology and includes the basics of anatomy and physiology, medical history, examination procedures, and medical reports. Students will begin developing a medical vocabulary through a study of roots, prefixes and suffixes, and practices of correct pronunciation and usage of terms related to the following body systems: integumentary, musculoskeletal, circulatory, lymphatic, cardiovascular, respiratory, digestive, urinary, reproductive, endocrine, nervous, and eyes, ears, and throat. The course also covers terminology related to diseases, diagnostic tests, and treatment of body systems. Students will also learn terminology related to radiology, pathology, autopsies, mental health, and discharge summaries. Medical laws and ethics. This course examines the role of the billing and coding specialist and the laws that relate to this role. Special emphasis on OSHA regulations, employer and employee liability, Patients' Bill of Rights, Americans with Disabilities Act, False Claim Act, and fraud. Medical office skills. This course is designed to introduce the students to basic office protocols for the medical environment. Students will also learn the general principles to communicate effectively in a medical environment by composing business letters, memos, and reports. Students will develop proofreading skills, review grammar, spelling, and vocabulary. Students will demonstrate professionalism when speaking to patients. Students will review medical etiquette. Students will gain understanding of pre-authorization and the SMART card, with a basic introduction to working with the medical team and appropriate roles and responsibilities. Concentration on medical office workflow, medical records management, correspondence, communications, computerized practice management, health, and patient financing. The insurance claims process. This is a course designed to teach the student about the medical insurance claims process. Students will learn developments of the claim, new patient interview and check-in procedures, established patient return visit, post-clinical checkout procedure, insurance company processing of a claim, and maintaining insurance claim files. ICD-9 CM coding. This course is designed to teach students about the diagnostics coding system, ICD-9 CM. HCFA ICD-9 CM coding guidelines. Primary and principal diagnosis coding, principal versus secondary procedures, coding qualifying diagnosis, ICD-9 CM coding system, disease index organization, basic steps for using the index, organization of the tabular list, basic steps for using the tabular list, working with index to disease tables, coding special disorders, and considerations to ensure accurate ICD-9 CM coding. CPT coding. This course is designed to teach students about the importance of procedural coding skills, CPT coding systems, PT format, CPT symbols and conventions, tabular conventions, index conventions, CPT index, basic steps for coding procedures and services, surgery overview, coding special surgery cases, medicine section overview, radiology section overview, pathology laboratory section overview, assigning evaluation and management codes, and CPT modifiers. Medical documentation. Students will gain a thorough understanding of the medical documentation process. Students will learn the guidelines for documentation, medical records, and laws governing privacy of medical documents. Students should be able to apply ICD-9 CM coding guidelines, CPT, HCP, CS billing considerations, code clinical scenarios, code medical reports, code operative reports. Filing commercial claims. This is a course designed to teach the students about the commercial insurance claim, insurance program comparison chart, step-by-step insurance for primary commercial claims, patient and policy identification, diagnostic and treatment data, instructions for Block 24, provider, billing entity identification, commercial secondary coverage, Blue Cross and Blue Shield plans. This is a course designed to teach the student about the National Blue Cross Blue Shield program, participating providers, non-participating providers, traditional fee-for-service coverage, national accounts, Blue Card program, BCBS and managed care, Medicare supplemental plans, billing information summary, step-by-step instructions of the primary BCBS claims, 2 BCBS full benefit policies, BCBS secondary claims. Medicare. This is a course designed to teach the student about Medicare. Concepts covered to include eligibility, Medicare enrollment, Part A, Part B coverage, participating providers, non-participating provider restrictions, private contracting, advanced beneficiary notices, Medicare fee schedules, Medicare as secondary payer. Billing notes, step-by-step claim form instructions. Primary Medicare with a Medigap policy. Medicare medical crossover claims. When Medicare is the secondary payer. Medicaid. This is a course designed to teach the student about Medicaid. Concepts covered include federal eligibility requirements, Medicaid services, relationship between Medicaid and Medicare, Medicaid's future, Medicaid as a secondary payer, participating providers, Medicaid and managed care, billing information notes, step-by-step claim form instructions, secondary Medicaid claims, mother-baby claims. TRICARE. This is a course designed to teach the student about the TRICARE option, TRICARE programs and demonstration projects, TRICARE service centers, beneficiary counseling and assisting coordinator, TRICARE pre-authorization, coverage services, TRICARE standard, program for persons with disabilities, non-covered services, TRICARE, medical review, CHAMP VA TRICARE as a secondary payer, TRICARE billing information, TRICARE primary claim instructions, primary TRICARE with a supplemental policy, TRICARE as a secondary payer claims instruction, workers' compensation. This is a course designed to teach the student about the workers' compensation and other federal compensation programs, state-sponsored coverage, eligibility classification of the job injuries, special handling of workers' compensation and managed care, first report of injury, progress reports, billing information notes, workers' compensation claim instructions, patient and policy identification, diagnostic and treatment data, provider billing entity, tracing delinquent claims, and insurance problem solving, claim management techniques, review and appeal process, problem claims, rebilling. Computerized billing. This course is designed to teach the students the concept of computerized billing utilizing the Metasoft or other softwares. Students will have a thorough understanding of the software program. Career development. This course is designed to assist the student in resume development, soft skills, interviewing strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for real-life experience.